Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for the last in our series of press conferences to talk about Delaware's response to COVID-19. We've been doing these press conferences now since March 11th of 2020. 74 or thereabouts in total, including some Facebook Live town hall meetings that we did in the evening and instead of the afternoon press conferences. First, we want to thank all the media representatives who have been loyal in coming to these press conferences. Now, most recently, signing in on the Zoom presentations that we've had. At the beginning, of course, we start with in-person presentations that were held in the Carville State Office building, and then ultimately, when the COVID-19 really was very strong in our state, we went to this more remote setting. We've been joined on a weekly basis by Pam, who's our sign language expert for the deaf and hard of hearing. Pam, we thank you for being with us each week and for the important service that you provide. We've had different others that have joined us, but most weeks we have Dr. Carol Rattay, who's the director of the Division of Public Health, and AJ Shaw, who's the director of the Delaware Emergency Management Agency. Both of them have played very important roles over the last 15 months in their respective areas. AJ, of course, has been our point person first on testing and then in vaccinations, working with the two Dr. Ricks from the Division of Public Health, who've just been a great team, and all our partners there. You may remember back in the spring, the hospitals were doing most of our testing when we were testing probably fewer than 40,000 a month. And we're kind of back to those levels. We peaked out in December of 2020, doing over 130,000 tests in a month. Our goal was to get to 80,000, AJ, so we far exceeded the goal that we set for ourselves, thinking that that was a number that the people of public health had laid out for us, what we needed to do to have good surveillance and to catch the cases that were out there. And in a minute, we'll show you the data dashboard again. That has been our guide throughout, measuring the presence of COVID-19 in our communities and making our decisions to close down sections, business sections, to advise people to stay separate, 6 foot distancing, wearing masks or not, over the last 15 months. I just want to thank everybody who's joined us. We've had as many as 30,000 or more that have tuned in back at the beginning, and we're down to 2,000 or 3,000 now, more recently over the last month or so in each of our presentations. So let's go again to the data. Let's see, you can see where we are. We're in pretty good shape now with fewer than 20 new cases on a 7-day moving average. The percent positive of the number of tests that we do, again, on a 7-day moving average is right at 1%. On some days, of course, we're lower than that. Hospitalizations, of course, is something that we can count. The hospitals do it every day. They know who's COVID-19 positive. They know if they're in their facilities or not. So it is that one really tangible, provable data point that we follow. And you'll see in the next slide, the roller coaster ride that we've been in since March 11th of 2020. Sadly, we've lost almost 17,000 lives, 1,694, each one a precious life, a family member, a relative, grandmother, grandfather, mostly, but others, of course, dear to us across our state. Here's the roller coaster ride that I referred to. It's the graph of the hospitalizations going back to when we first started counting in late April, early May of 2020. At that time, as I said, we were doing very little testing, so this was the best data point that we had. We got better and healthier after the first surge there in late April, early May, during the summer month as people started to circulate more outdoors, more outdoor activities. And we hit a low of 29 people hospitalized on August the 16th of 2020. Then we saw the late fall rise up, the late fall peak there in the December holidays, first of the new year, where we peaked on January the 12th at 474. One of the biggest concerns that I had as governor and that we had as a team was our hospital capacity. I must say that we never did approach that capacity, and that's a really good thing. And thanks go to our hospital administrators and teams in our hospitals that were able to manage the census there to provide for the care necessary for those that were COVID-19 positive and sick enough to need hospital care. The hospitals did learn a lot about treating COVID-19, and we're much better at it in the second surge in around the new year and into the 2021. We then, again, on the other side of that peak, got healthier as we moved into the spring, and then had another little mini peak as we moved into the month of June, month of April. We hit the peak of 180 and then got better until just the latest number where there are only 19 people. And that's, we did hit a lower point last week at 14, but today we're sitting there at 19. One of the other real efforts, and thanks go out to all our partners here again, physicians across our state, pharmacies, and you'll see in particular the rural pharmacies are playing with respect to vaccinations today. Over 1 million vaccines administered by state public health officials, by physicians, by our paramedics, by hats go off again to our Army and Air National Guard that have helped us at all these vaccination sites, to our hospitals, healthcare providers. And as I said, the pharmacies really came up big. Fully vaccinated, closing in on 500,000 people. We're just short of our goal of 70%. You can see it there, 69.8%. We could really round that up to 70%. We'd be there, but we're going to hit the exact number in the next couple of days. We've got about 1,500 shots to get in arms to join the 16 other states and the District of Columbia that have reached President Biden's goal of 70% of adult Americans to be vaccinated by July 4th, so we can celebrate Independence Day more independently than certainly the last 15 months. And of course, we really have gotten great cooperation from our senior citizens. 93% of Delawareans 65 and older have received at least one dose. We do know, though, with that 93%, that other age groups, particularly young adults, 18 to 35-year-olds, are still under-vaccinated, fewer than 50%, less than 50% vaccinated, and need to get them to step up to the plate. Any concerns that they have, getting them reconciled so that we can be safer throughout. The next graph just really shows the two peaks back in the spring of 2020, the December-January peak of 2021, and the arrival of vaccines in early January, actually mid-December, as I recall, in early January, as we started to vaccinate those Delawareans 65 and older, and really did help squash the number of people treated for COVID-19 vaccines and the deaths that arise from it. So the deaths are on a 7-day moving average on the right-hand vertical axis, and the number fully vaccinated on the left-hand vertical axis. So you can see there those surges and the effect of vaccinations on that. Now we know, and there was just an article out this week, an AP story, that nearly all the COVID-19 deaths today are among the unvaccinated populations. Overwhelmingly, the number of those who test positive are those who are unvaccinated. So much so that CDC has recommended that those who are fully vaccinated no longer need to wear a mask. We all, of course, know that for weeks now. But those that are not fully vaccinated should wear masks indoors in public, and just be careful with distancing and circulating. I have been out at many of our large department stores. Walmart has a great pharmacy program, and encouraging people as they come in to the store to visit the pharmacy if they haven't gotten vaccinated. We know, as AJ will report in a minute, that most of the vaccinations that are being done right now are being done in our pharmacies, and we thank our pharmacy partners for that. Clearly, if you need to get vaccinated, the easiest way to do that is go to your local pharmacy and get a shot in your arm. We're still focused on encouraging and incentivizing Delawareans to get vaccinated. Our DE Wins program is wrapping up this week, so you need to get vaccinated today to be part of the DE Wins drawings, which are going to come on June 30th. So make sure you get vaccinated today so you're eligible for those drawings. We did draw some college scholarships yesterday, and we have some new prizes with family memberships to the YMCA. We also have courtside tickets and VIP experiences at the Delaware Bluecoats that we're raffling off as well. And then the final drawings for the 2 low-digit license plates, as well as the $302,000 grand prize ticket to be drawn on June the 30th. You need to get vaccinated today so that you're eligible for those prizes. One of the major focuses of our team, and obviously our partners in the school districts, the superintendents and their teams, principals and teachers, is to make up for lost learning for students across our state. Every public school now has digital access to books. We're really focusing on getting children to do more reading this summer, particularly the elementary school children learning to read. Students also have seamless access to DE Public Library. Digital collections. For more information on summer learning, visit de.gov/digital DE or talk to your local school districts. I noticed at the school, Warner Elementary School down the street from me, there are lots of students still in school learning and making up for some of the lost learning that they've experienced this year. So that's it for my report, this final press conference of our 15 months. And I turn it over to Dr. Carol Rattay. Thank her and her team for all their work over this last 15-month period in time.
Thank you so much, Governor. It's been quite a period of time for all of us. I want to thank you for your leadership and also, again, reiterate a thank you to the media for hanging in there with us and helping us get full information out there to Delawareans over this time period. It's been so important to us to be transparent with information as it has evolved and as we have learned. And we really are happy right now to see that we do have good news as it relates to our infection spread right now. Our case counts have decreased 34% since last week. Positivity rate remains at 1%. As you saw, hospitalization rates have decreased again. And so, we're in good shape as far as the level of infection right now. We don't have any areas of concern again this week, and we will keep an eye on that. But right now, overall in Delaware, we're pretty quiet on the amounts of COVID infection that we are seeing in our state. We are continuing to see infection though, and that includes variants. So every week we've been talking about the variants that we are seeing among the cases that we're able to test. And we continue to see mostly the alpha variants, or what we've been calling all along the UK variant. So that one has increased more than 30 since last week. The Gamma variant has increased by 6. The Delta variant is the one that we're keeping the closest eye on right now, as that appears to be the most contagious and is causing more problems, certainly in other parts of the country and world. We only saw an increase by 2 since last week of the Delta variant, but we are going to keep a very close eye on that, and we will continue to keep you all informed at least on a weekly basis as we keep an eye on the Delta variant. We are going to continue to sequence specimen. We have sequenced over 3,100 specimen at this point in our lab, 62 last week. And the percentage of the specimen that we tested that are positive for one of these variants over the past week was about 42%. But again, we'll keep a really close eye on that. The great news is that of the variants that we are seeing, the vaccine remains the best protection against all of these variants. And so best way to protect yourself from getting any of these variants is through vaccination. But again, if you are experiencing any symptoms of COVID, we want to strongly encourage you to get tested. So please keep that in mind. You can visit our website, de.gov/get tested for the list of testing locations. I wanted to talk a little bit about the safety monitoring of vaccines. We are monitoring these vaccines more intensely than any vaccine that's ever been administered. With the issues around myocarditis making news in the last few weeks, I wanted to talk a little bit about how CDC and federal regulators are tracking vaccine safety. And there are several safety monitoring systems which provide the opportunity for almost real-time reporting of adverse events. Now, one of these systems is called VAERS, and that's been around for a while. It's the Vaccine Adverse Events Reporting System. It's a national database, one in which medical providers know to report any adverse events, and the public can also report any potential adverse events through the VAERS monitoring system. In fact, when there's severe adverse events, and doctors are required to report, and they don't have to prove that it's the vaccine that caused severe adverse events like death or hospitalization, but they report these events through VAERS, which serves really as an early warning system. So the VAERS system can help to detect possible safety issues with the US vaccines, collecting information, a wide variety of information that can occur after vaccination, allowing the federal government to then take a closer look to determine whether there may be a relationship between the vaccine and these adverse events. New with COVID is vSafe, and this is a smartphone-based tool that uses text messaging and web surveys. So when people get vaccinated, they have an opportunity to get signed on to vSafe, and where they can get personalized health check-ins, and also, they can tell the CDC very quickly if they've had any side effects after getting the vaccine. And depending on their responses, CDC may follow up with them by phone to get more information. Additionally, the vSafe is nice in that it reminds people to get their second dose if needed too. So vSafe has been a really great new tool to help monitor vaccine safety. And also with COVID, there's now a vSafe pregnancy registry to collect information about pregnant women and their vaccine experience. And so those who choose to enroll in this registry will be contacted several times throughout their pregnancy and even during the first 3 months of their child's life to help monitor the response and any side effects related to the vaccine. And thus far, of the 124,000 women who have indicated they were pregnant when they enrolled in vSafe, 5,000 have enrolled in the pregnancy registry, which is just really helpful for getting additional information and for us to know that not only are these vaccines safe for pregnant women, but they're also protective for the babies by transferring the immunoprotection over to the baby when the baby is born. So if you have if you want any additional information, you can Google any of these systems, or you can go to our safety and monitoring section on our de.gov/COVID vaccine webpage to get additional information. Now I want to talk about a more grim topic, which is the drop in life expectancy over the past 2 years, which is due to the COVID pandemic. Interesting, but not surprising information from a recent study looking at the long-term impacts of the COVID pandemic showed that life expectancy in the US has dropped by 2 years, from 78.7 years in 2018 to 76.9 by the end of 2020, which marks the largest drop in life expectancy since World War II. And unfortunately, this impact was seen more dramatically in Black and Brown communities. So African-American individuals saw their life expectancy decrease by 3.3 years, and Hispanic individuals saw their life expectancy decrease by nearly 3.9 years. Now, several factors do play into this decreased longevity, including COVID-related deaths, disruption in healthcare, disruptions in chronic disease management, and behavioral health impacts, where people struggling with addiction, disorders, and depression may not have gotten the help that they have needed. Now, we've already discussed many times how the vaccine is your best tool to prevent death from COVID directly. But in addition, as we try to get back to a more routine way of life, DPH will be increasingly focused on encouraging people to resume routine screenings and seek access to mental and behavioral health services. We encourage everyone to assess where they are and where their family stands on their own healthcare appointments and screenings, and encourage everyone to begin making appointments for those that they may have delayed, and to not wait to seek any substance use or mental health treatment that is needed. So one of the best ways to raise our life expectancy again is for more people to get vaccinated. And many of the barriers to getting vaccine have been addressed. There are some sites that are providing free childcare, free transportation through Uber is available. Some businesses are providing free or paid time off. There's many convenient places to get vaccines right now. And remember, you should not have to pay anything out of pocket to get your COVID vaccine, whether you have insurance or not. So to get more information, go to de.gov/getmyvaccine for more information. In the meantime, and as the state of emergency soon gets lifted, please keep in mind that there are some restrictions that will need to remain. So for example, in long-term care and healthcare settings, masks will be required. Some visitation restrictions will remain in place in long-term care settings. And we really need everyone to follow the CDC guidance on mask wearing, especially if you have not been fully vaccinated, and to get tested if you develop symptoms. So Delawareans, please be safe and protect yourselves and your loved ones and your neighbors. And with that, I'm going to hand it back to you, Governor.
So now, thank you very much, Dr. Rattay. That'll be our message now for the weeks and months ahead as we move in to the middle of the summer and into the fall, really focusing on getting students and staff in our schools vaccinated. The watchword will be get vaccinated. AJ Shaw has been heading up, the point person there, working with Dr. Rick Pescator, Dr. Rick Hong, really doing a great job with all of our partners. Right now, it's coming down to the pharmacies, AJ. They're really stepping up big for us.
No, it is, sir. And good afternoon, everybody. So last week, we'll go over our testing numbers one last time. We did see another dip last week, 9,600 versus the 11,400 the week before. However, I think we're still looking at the other metrics, 1% positive that we're seeing across the state. So we know the vaccine's working. We know that, we're getting people tested to identify that as early as possible. And we still have, multiple avenues available to get tested. So again, if you think we were doing, 40,000 a week a few months ago, and now we're doing 9,000. But in the meantime, in that time, we've also vaccinated almost, 69, 70% of those over the age of 18. And it just shows you the impact we're having between both fronts of these. As the governor was saying, we're really looking at where people are getting vaccinated right now. So back in April, when we were doing more people in a weekend than we're doing a week at a state site than we're doing a week right now. Out of that, about 36% of those vaccinations were taking place at the pharmacies. 27% were being done at distribution events that the state was managing, whether it's the ones we do with FEMA, the ones our county paramedics assisted with, Lisa or Diane's team at Public Health, the National Guard, et cetera, is doing about a quarter, 27% of it. And the pendulum swung. We've talked now for several, really 6 weeks or so, how that, we hit that point where just the demand was not as much. The supply, really came in overnight and outpaced the demand. And now we're doing about 71% of the vaccinations in the state last week that were done at the pharmacies. And no surprise. I think, if you listen to Dr. Tay and Dr. Hong earlier in the year, a lot of vaccines are done through the pharmacy network. Flu vaccines, huge providers are through the pharmacies year over year. And now that's where people are going to get their vaccine. Great network. They're in every community. They're trusted. However, the state's still doing a lot of important work, and not just us. We have employers that are bringing vaccination partners on site. We have schools that are getting ready for events when we concentrate heavily on this 12 to 17-year-old population as we go back to school. Long-term care facilities, our Department of Corrections, all have played a role in getting these done. But, if you look last week, we held 90 events in communities, which equaled 8% of those people that were getting vaccinated in the state. And just one we want to point out here, this is really a Wilmington Police Department initiative. It was done last Friday, got just about 20 people. It had Wilmington Police Department, and it had our National Guard partners. It had Lisa Henry's team from the Division of Public Health. And they went in on Van Buren Street and vaccinated people, went door to door, talked to people, educated them about the importance of vaccine. And so for 8% that these events are getting, it's getting into the community. It's getting in that micro level that we know is important to make sure we tackle the vaccination across the state and not just expect people to have someplace to, go to someplace to get vaccine. So as we, we have the 70% goal, hit that in the next few days. As we come out of that, we know we have to concentrate on the 12 to 17-year-old population, but we're still going to be in the community. It's going to be the events like this. It's not going to pull in hundreds of people, but the people it pulls in are the ones that, are just as important to us, and we want to make sure they have the access as well. So again, just because the DE wins competition's ending tomorrow, just because, we're not doing the weekly press conferences, this vaccination effort is what is going to help keep Delawareans safe, help us get the kids back to school in the fall, and go to the de.gov/getmyvaccine and find out where those locations are in your community. Help talk to your your family and friends and point them there as well. So with that, Governor, back to you.
Thank you, AJ. Certainly Delaware does win when everybody gets vaccinated. Our goal to have 70% of adult Delawareans vaccinated by July 4th. We're right on the doorstep right now. With 69.8% rounded up, we're right there. We got about 1,500 shots to get in arms. We've got a great team out there. As AJ said, most of the vaccinations right now are being done by our pharmacies across our state, 71%. That's been the case for several weeks now, as the supply of vaccines has increased and improved over the last several months. Remember back to January and February where people were clamoring to get their first shot, get their shots. We had that one big event at Sleazeham School. We had to shut it down after we saw such an incredible surge in demand. Now, of course, there's plenty of supply out there for anybody that needs to get vaccinated. If you have any questions, make sure you contact your local physician, healthcare provider, Division of Public Health. We've got answers to the questions that people have. And if you get vaccinated today, you're eligible for the raffle drawings. DE wins. Everybody wins when you're vaccinated. We've got 2 low-digit license plates to raffle off. We got the $302,000 grand prize. We got other prizes, family membership to the YMCA in particular that have joined us, and we're really in a good place. It is important to note, as you did, AJ, that we've got lots of people on the street. Darrell Chambers and his community outreach team has been knocking on doors, hanging out flyers for months now. really pulling people out to get vaccinated, particularly in communities of color across our state, and in particular here in the city of Wilmington and Newcastle County. So thank you to all our partners throughout the last 15 months. It's been a long road. We're in a pretty good place right now. Still got a lot of work to do to get our students vaccinated and more school personnel vaccinated as we approach the school year next year. A lot of lost learning that we need to make up. I know the districts and schools are focused on that. That's going to be where a lot of our energy goes. Legislature is in, wrapping up their session, passed the budget, the capital budget's up for a vote today. Very appreciative of their good work. And so with that, I know we've got media that have joined us. We thank you again for joining us loyally over the last 15 months. At the beginning when we were doing them twice a week, and since going to the Zoom format, we appreciate your presence and getting the information out. I've been reading a book, as I think I mentioned a week or two ago, by the former Chief Speaker of the House, John Boehner, who said, "A leader without followers is just a guy out for a walk." And we've been able to maintain conferences and through the media networks that you all represent. So thank you for your partnership, and we look forward again to your questions.
All right, first we'll go to Nick Celina with Delaware Public Media.
Good afternoon, everyone. This being the last press conference and with the state's emergency order soon coming to an end, I was hoping you all might offer your assessment of the state's response to COVID-19. Hindsight being 2020, and looking back, is there anything that Delaware could have done differently, and is there anything that the state did particularly well?
Yeah, I think there'll be an opportunity for that assessment. We've had our heads down, everybody at public health and the emergency management teams, kind of delivering the services necessary to respond. And it's maybe for others to determine the success. We do want to look at what we did well, what we didn't do so well. I can tell you that from my opinion, one of the high points will be, one of the positive points will be the way we responded to the outbreak in the Hispanic and Haitian Creole population of poultry workers back in April of last year. Very coordinated effort on the ground, in the communities, in the plants. Very difficult situation with plant management and with other officials, and mostly Sussex County, but Kent County as well. But in the end, I think the numbers speak for themselves in terms of hospitalizations and fatalities and number of people tested. I think that'll be, community outreach was, I think, particularly impressive during that. Obviously, the hospitals throughout have been a great partner. They've had a very difficult and challenging thing to do with a kind of an unknown virus. They learned a lot in terms of treating COVID-19. I think our public health team for sure will be a positive, and I would argue that our testing and vaccination approaches were good as well. But we'll let others, we'll assess it ourselves as we move forward, particularly to think about what we need to do in the future. I do think at every level of government, particularly at the federal level, the stockpile of PPE and other necessary things to respond to a pandemic like this, needed some work, and I'm sure somebody will do an analysis of that as well. Dr. Rattay, any thoughts?
I will just say, I think we're all about constant learning and improvement, and we at Public Health will be doing a formal after action report, as is AJ and his team, and so we're all about constant learning and improvement. But I just want to take the opportunity to say how grateful I am to have worked under the leadership of the governor and his amazing team, and AJ and his amazing team, And I could not be more proud of the people at Public Health who have made just extraordinary sacrifices over the last year and have just done such a superb job in responding to this pandemic.
Any thoughts, AJ?
So I think, Nick, I think that's a question we've asked ourselves for the last years. What could we have done better? Could we have done better? And we formally started the statewide after action just about a month ago. It's going to take months to do. We have an outside consulting company that's going to help us off, and then Dr. Tay and her team's going to do more of a micro one. But I wish we could have started it 6 months ago, 9 months ago, because we have learned so much as a state, not just for a pandemic, but for crisis management overall. We've seen where our partners get stressed. We've seen where we've had maybe assumptions made in plans where it didn't go the way we thought it would when we write a plan on paper. You write a plan, it's only good as the minute you print it off, and after that you have to be able to adjust and be flexible. So I think public health, I think emergency management, I think executive branch governing authority is all what has been helped us be successful here. But we have to make sure we learn from this, and not just learn for hopefully the next pandemic's not for 100+ years, but we've used the term all hazards in emergency management and public safety now for years, and this could happen with a number of things. And we will make sure that we refine and define and improve these plans. And I think there's good stuff and there's going to be bad stuff. And the way I tell people when we do after actions before is, you're going to read something and it's going to hurt you a little bit in the gut, right? It's like a punch to the gut when you read something, because we put our heart and soul in the sacrifices the team's made that Dr. Tay said is huge. But then you got to put it down. You got to take a deep breath. You got to go back and say, okay, there's got to be some truth in there. What can we do better next time? And I think we just got to make sure the state's better prepared tomorrow than they were yesterday. And that's the goal that Dr. Tay and the governor and I will have, and make sure that's the way we leave it.
Nick, Dr. Tay and AJ both mentioned constantly learning and evaluating what we were doing throughout the last 15 months. And we certainly did that. I think about the experience that we had at Salesianum School, where we learned, when the demand was that great, almost at a level, uncontrollable level, and with social media being so important in people's lives now, that we had to have a registration system. We just couldn't control, just say, open the doors and say vaccines were available. And there are lots of examples of that kind of learning, but both these two leaders, AJ and Dr. Rattay, have really underscored that point, that we were learning as we went day by day, week by week, month by month.
All right, thank you.
Right, next we'll go to Brandon Holbeck with the News Journal.
Good afternoon. I know that throughout the year we've talked a little bit about people who've suffered from symptoms long-term after contracting COVID-19. Do you have any sense of what symptoms are most frequent in people that have them several months after first testing positive for COVID-19, or any gauge on how common that is among the cases that we've had here in Delaware?
Dr. Rattay?
Yeah, it's a great question, Brandon, and it is something that we're very concerned about. We often talk about, the significant consequences of death and hospitalization for COVID, but we're learning more and more that even people without symptoms who were COVID positive are struggling with some longer term consequences of COVID. The most common one seen in the national data from several research studies is fatigue. Chronic fatigue seems to be quite common. People who've lost their smell or taste can have that be prolonged, but also there are individuals who have some shortness of breath that can last for a while. As well as headaches and some other neurological symptoms. So, I think we have a lot to learn from studies, and certainly we're going to want to learn from Delawareans who have had COVID. We're going to continue to look at this closely and work with our healthcare partners to help address the longer term consequences as we move forward.
And you discussed it a little bit earlier with the Delta variant, which we still haven't really seen that many of here in Delaware, at least among the specimen that have been tested. Just wanted to kind of get a gauge of how concerned, or if you're concerned about the Delta variant and just what that means moving forward for the state.
Yeah, so I am concerned about it, Brandon. We have almost 70% of adults have had one or more dose of vaccine, but we have many individuals who have not yet been vaccinated or are not fully vaccinated. And the Delta variant appears to be much more contagious even than the UK variant. And while the vaccines that are out there seem to be protective against the Delta variant, again, we have many unvaccinated individuals. And so it is certainly a significant concern of ours that we may see pockets or clusters of infection in the fall when we have greater potential for a resurgence of the virus. And I will add to that, none of us want to go backwards. None of us want to go backwards and shut anything down and mandate mask wearing again, and putting some of the other restrictions that are in place. And this adds to really our plea for people to get vaccinated so that we don't end up in a position where we have to go backwards in the future.
All right, last we'll go to Tim Mastro from Delaware State News.
Hi, everyone. I just want to ask about testing. At this point, I think there's been over 700,000 different people tested, almost 1.9 million tests. But with vaccinations up and case stats down, who are these people that are still getting tested? Do you know if they're vaccinated or unvaccinated? And are you still able to get people getting tested for the first time?
AJ?
So I'll start with your last question first. I don't know how many, what the number is for first people that are getting vaccinated. I will tell you there are people that need it for work, that need it for traveling, people that are concerned, people that might have, cold symptoms or something like that. We have seen a drop, right? We have seen a lot of locations that don't see a fraction in the traffic. We see partners that are doing, single digits a day versus, the hundreds they were doing a while ago. So it's a little bit of, everybody has their reason to go. We've talked about our partner Curative here, multiple times. We talked last week how they're shifting away from the on-site, or shifting away from the Deltec vaccination sites to do more roaming stuff. And part of that's going to be identifying some of these testing sites that have a high number of people through foot traffic and try to do some vaccination or at least education at those sites for those individuals. But again, we know there are a lot of people that are getting tested even though they've been vaccinated. We've got questions, hey, am I going to show a positive if I got vaccinated? So, we do not want to suppress testing because we still know we know 30+% of the population 18 and over haven't been vaccinated, and we still have those a younger population that doesn't even have access to it yet. So it's again, it's a resource we have to have out there. We have it readily available. And again, Dr. Hong and Dr. Pescatore are even looking at kind of what's the next vision of it's going to look like to make sure it's throughout the community.
And if I can add, it's certainly to be expected that testing has decreased because for the most part, vaccinated people don't need to be tested unless they have symptoms. But testing is going to remain an incredibly important tool for us in the future, in the future months, especially for unvaccinated people who work or live in congregate settings, in the school setting. And so we're going to need to continue to be doing testing and contact tracing and quarantine and isolation as needed to keep this virus at bay, especially for individuals who are unvaccinated.
All right, and just kind of along those lines, based on what you said, so there's no thought of just kind of scaling back testing because of low demand? Well, is testing still going to be as widely available as it was last summer over the winter with all these different sites?
So I think, we're talking about maybe cutting it back. I think we're doing a Saturday site now. We might cut back to just doing it 5 days a week over the summer. And then we're actually looking at like changing some of the rapid testing as well. So we have other options for people. So, it's something really we're just at the initial part of some of these conversations to figure out what's the rest of the plan for the summer is going to look like. But we know Dr. Pescador is already working with the Department of Education and the schools to have on-site testing in the schools come fall. So it's, it's again, like we just talked about, we were looking back on the last 16 months, same with the testing program. We're going to continue to, evaluate it and reassess it as it's needed and where we are during the pandemic.
All right, there are no more questions today.
All right, very good. Just want to thank again the media for joining us as you have each week, twice a week back early last year. For those of you who have not been vaccinated, still got a chance to help us put us over the finish line for July 4th with 70% of adult Delawareans, de.gov/getmyvaccine, or call the phone number that's up on the screen. We appreciate the work of all of our partners, Dr. Rattay and AJ Shaw on our screen here. Thank Pam for her presence each week, our sign language expert for the deaf and hard of hearing, and for the thousands, tens of thousands of Delawareans who've joined us. Thank you for your comments, most of them. We appreciate you tuning in to help us lead Delaware through this COVID-19 pandemic. We look forward to ongoing communications about the situation here in our state through press releases, through our website, through periodic press conferences. But we'll sign off for the last time with these weekly press conferences. We thank you for joining and thank you for everything you've done to keep Delaware healthy and safe.